I'm very delighted to be here today representing the Care Quality Commission and talking about some of our work. I personally have worked in healthcare my entire working life, which is about 35 years now. I was quite interested to hear that work helps you to keep healthy. So that's really good, because I certainly think that I've got a great job actually, and it's a very privileged one. As an inspector, I get to go in and out of a very wide range of different services, both in the NHS and the independent sector, seeing lots of innovative practice, and people really going the extra mile to meet people's needs. On the home front, I also have one of my 3 children combines a serious physical health issue and mental health needs, so that keeps me very grounded about why we need to get services as good as they can be, and also why it's so important for services to be integrated. So, just a little bit about the Care Quality Commission. So, we are the regulator of health and social care, and this is our purpose and role. We're very conscious that mental health care is not just provided in services that we regulate, but we cover primary medical services, that's GPs, ambulance services, hospitals, social care. So we get an opportunity to visit lots of different services where they are providing services. So just very quickly, I'm just going to talk to you about what our current view is, particularly focusing on the healthcare services that are provided, what our key concerns are and what our priorities are. So this is, when you look at mental health trusts in England, they're the largest provider of mental health services. It's really positive to note that actually 64% of them, actually 68, are either good or outstanding overall. However, that still leaves 33% who are inadequate or requiring improvement. And when we look, so we actually visit different types of services. I know that it doesn't always follow logically, and that of course people receive services from a wide range of different types, but this is our model of inspection. What you will find is that actually in terms of where we have the poorest ratings, they tend to be very much in the services which are supporting people with a severe mental illness, where and also where they're really needing care in a crisis. So acute inpatient wards, community mental health services for adults, and services for people in crisis are the ones which have the poorest ratings at the moment. Without a shadow of a doubt, safety is our biggest concern. But what we get the opportunity to do is, through all our inspections, we get the opportunity to bring together some key themes that come out of our inspections, and these are some of them, all of which will be very familiar to you. And then we also get the chance then to work with others around how that can be addressed and improved. So just to kind of look at a little bit more around some of those concerns. So, unfortunately for people who do need to be admitted to an inpatient service, the environments are often very poor. We've done a particular piece of work recently looking at people accommodated in dormitory accommodation. I mean, really, the thought that when you can be at your very most unwell, that you're having to share a living and sleeping space with other people who are equally unwell, really feels very unacceptable to us. I've personally led on a piece of work around sexual safety. Again, one would think that for people who are most unwell, then when they're admitted to hospital, that they should be safe, but unfortunately there are very significant numbers of sexual safety incidents which occur on the mental health wards. For rehabilitation, we've particularly highlighted the fact that for people receiving rehabilitation, sometimes for really a very significant length of time, that they're often placed a long way from home. More recently, with Wharton Hall from the Panorama programme, we've had to reflect very carefully about how we inspect closed communities where people are receiving services that in very geographically isolated areas and where it can be very hard to actually hear about people's experiences within those environments and where things can go very wrong outside of the eye of many visitors to those services. So that's an ongoing area of work. We're also, along with many other organisations concerned, to ensure that physical interventions such as restraint are used appropriately and that they're correctly reported and recorded, and staff are appropriately trained to use those interventions. And again, linking back again with particularly the work of Health Education England, we're very minded of the fact that many providers are really struggling with their staffing. So, as I said, we get the chance to bring it all together and we produce lots of different material. Our main one that comes out once a year is the State of Care report, but lots of other work as well. And then what we then get an opportunity to do is to do some particular in-depth looking at particular areas. So at the moment we are doing a piece of work particularly looking at the use of seclusion, segregation and restraint for people with a mental health problem with a learning disability or autism. And we look at a whole range of different things when we do this piece of work, including, for example, things like the quality of the leadership, the impact on people using services, about why that person has ended up needing to have that kind of restriction in place. And this work is divided into two phases, the first part of which has reported recently and has started to highlight some of the issues that have come out of the work. And that's particularly from the work we've done already looking at inpatient services. And now a second area of work is underway looking at the experience of people in residential care services, so adult social care. So, and in children's homes, and that piece of work is being done with Ofsted. So this is an example of how we can use our knowledge and then hone in on particular areas and look at them in more detail. The methods that we use, again, as we were hearing about, very much based around use of proper advisory groups, bringing together people with a great range of skills and ensuring that the work we do is done in a co-produced manner with people with lived experience. So this is just some of the themes that are coming out of that piece of work, it just really shows how the work we do can kind of really shine a light on the experiences of people using services and some of the changes that need to happen, some of which can be done by the provider themselves, but some of which require real partnership working in order to make those improvements. So, we've had a real focus because we're really concerned about inpatient services, and the reason is because first of all, it's coming out in our inspection ratings, and we highlighted it in last year's State of Care report. It's been highlighted in the report done into the Mental Health Act. And again, linking in with the reason we're here today, the NHS long-term plan has again highlighted the huge variations in services across the country. And so, the type of areas that we are really focusing on is, first of all, where we're working to ensure that the physical fabric of wards is good, that people get access to a full range of treatment and care interventions. We're particularly concerned about access to psychological therapies, making sure that there are the staff with the right skills and training, that those services are well led, and that they interface with all the other services they need to make sure people get a chance to have a good discharge. So just really just wanted to kind of again just explain really about in the context of improving the quality and safety of inpatient care, about how we work again, and the fact that we bring together all the learning from the different inspections that we take. We try to work with providers. We listen to what patients who use the services tell us. We look at themes such as sexual safety, and we continue to work to ensure that boards of organisations also are well cited on the issues that they're facing, and they're taking steps to improve them. So thank you very much indeed, and I hope that's given you a little bit of an oversight of our work. So thank you.